Hello, everyone. My name is Jenny Ravelo. I'm a senior global health reporter for Devex. Thank you for joining us today in this workshop, which is part of a series of events that we're hosting in partnership with the Novartis Foundation. Our workshop for today is about building health workforces for the future by leveraging the opportunities of artificial intelligence, or short for AI. When we talk about AI, we often think of robots. Well, they're part of it, but think about telehealth or telemedicine just for a second, which has been a really useful tool or setup during this COVID-19 pandemic. With lockdowns and people unable to visit hospitals as they would normally do in normal times. It's been helpful for patients, but also for doctors and other healthcare workers who've been able to use it to do patient monitoring or consult with patients remotely. And that's something we'd like to delve into more today. Looking at examples of how data and technology are and can empower and support healthcare workers to expand their reach and impact. And we hope that all of you would be able to share your ideas, your expertise, and lessons from your own work in this field. Later on today, we'll be breaking into smaller groups as we start the workshop. But first, we'll be hearing directly from a doctor in Uganda on her experience, on the challenges she and other doctors and healthcare workers face on the ground, and how AI is helping them and can be of further help to them. So to start off our discussion today, I'd like to welcome Dr. Priska Kizito. Dr. Kizito is the emergency medicine physician at the Mbarara University of Science and Technology in Uganda. She is also the president of the Emergency Care Society of Uganda and one of the few emergency medicine specialists in the country. Dr. Kizito, welcome and thank you for joining us today.
Thank you. Thank you, Jenny.
Well, I know this is a tough time for physicians, for a lot of healthcare workers in Uganda. The country is currently experiencing a surge in COVID cases and deaths. Can you just talk us a little bit, what are the challenges you and other healthcare workers are facing currently in the country?
Okay, I think one of the biggest challenges has been the fact that this wave took us unprepared as generally the health system of Uganda. So hospitals were not ready for the surge. And so in terms of that, resources, both human and PPE, or what we call protective equipment, were all limited. And so that has led to burnout, in addition to loss of lives of our colleagues. And unfortunately, we have to try to find a way of dealing with that. Besides that, there is also the fact that hospitals in Uganda are poorly facilitated in terms of equipment, so critical care, and yet this particular wave has brought up very many patients who are very sick, who are critical, and they might need anesthesiologists, intensivists, and then critical care supplies, and those are on the lower end. The other thing is the fact that we are still in the phase of building our emergency medical system. There's a challenge of the referral pathway is still a challenge. There are some good days or some good cases, and then there are some cases that find challenges to get to those the high level care that as it's required. And lastly, of course, facilitation of those that are involved in the care of COVID-19 patients is still quite low. From my understanding, I think it's something still low, unlike in other resource-rich countries. And so there's poor motivation for people to actually take that extra step to help out if they are not already part of that team. Yeah.
There are a number of challenges you're currently facing. How do you see data science and artificial intelligence being of help to you and other healthcare workers during this pandemic?
So I believe from literally data, the word data science, to be the collection of data in a particular way to try and make it useful. So if we had maybe artificial intelligence to help out in making that easier without getting people physically in different places, it would help us replace the risky areas of data collection to enable us make use of that data in terms of disease patterns, in terms of distribution of, for example, vaccines in the different areas. And that way we would know which areas are receiving a lot more. Is it equitable? Is everyone, old, young, rich, poor, receiving care the right way? And then in addition, it would help us maybe know what limitations do we have at different levels of healthcare without us having to visit places physically. And then once you know the limitations, and maybe we know that we have things like digitalization of x-rays or CT scans that are easily available in places, it would make diagnosis of not only COVID, for example, but also other illnesses in all these different places in Uganda. So it would quicken patient care that way, because you know the diagnosis quicker. Maybe I know the best example for AI is actually robots. So maybe if we had robots actually screening for infectious diseases besides COVID and other things, maybe doing vital signs for us quicker, it would be quicker because we already have limited resources in terms of human labor, or actually underemployment of people in terms of our system. So maybe if we had those things to enable, close the gap, then we would have quicker outcomes for us, better and quicker outcomes for our patients. Yeah.
You also talked about earlier about burnout. I'm just curious, how do you see, an area there where perhaps data and AI can help?
Yeah, I think AI, because it's basically machines, I would say replacing most of what is lacking. So maybe the one person who would be seeing 24,000 patients in terms of ratios of doctor-patient ratios or nurse-patient ratios, maybe it would reduce how much workload they have on their hands, because you're the one triaging, you're the one managing, you're the one moving the patient from one side to the ward, from the emergency department to the ward. Maybe if we had that incorporated into the system, it would give us less work to do. And then, of course, enable that it would introduce trust in the system beyond the human capacity. So, yeah.
Do you see a potential for AI beyond this pandemic?
I see a lot of potential for AI beyond this pandemic. I don't know whether we have the capabilities to have AI fully incorporated into our healthcare system as Uganda, but I think there's potential, because what this particular wave, or even generally what pandemics have showed us, is that you're not able to reach what you need as soon as possible. Whether you're just a healthcare worker, you're either few or you're either handy, so you're overwhelmed. And so if after the pandemic, we think through this gap of lack of enough resources, human resource, and the fact that AI could actually meet that gap, while of course blending it with the human capacity, then maybe it could actually be incorporated and stay within our healthcare system. But also basing on the fact that there's something called virtual reality that's one of the institutions that has helped in guiding in the task force, the Infectious Diseases Institute of Uganda. They have a program on virtual reality training. And so maybe if we could actually step up to use that even more in the different institutions, that way we would introduce AI in the system in terms of training up or in terms of delivering things, equipment or treatments in different places that are hard to reach. And if the clinicians or that policymakers are to think of it that way, maybe it would take a place in the current healthcare system. Yeah.
I think, there's some fear around some health workers, whether AI would replace them, in this in the current health system. How would you address that?
I think first of all, sometimes fear comes from not knowing what the thing is that people are trying to introduce or trying to incorporate in the status quo. So maybe sensitization, and by sensitization I mean mass sensitization of health workers and also the public, because fear won't only be from the health workers, but it will also be among your patients. If they see a random machine or a system they've never heard of, then that would induce fear. So maybe mass sensitization, basically, of both health workers and the people that take on these services would be helpful. And then the more you use something, so once you sensitize, introduce, but not aggressively. So slow introduction into the system and allowing it to blend smoothly into the current system. That way they get a feel of what has been there and what is new, and appreciate what the new may help with. And then that way they get to improve on the anxieties that they have around this artificial intelligence, because it's within us. And then they see the good things. And if there are any bad things, we learn to deal with them as human beings while improving outcomes in our healthcare system.
Well, thank you so much, Dr. Kizito, for sharing your insights, the situation of healthcare workers in Uganda, and for sharing your time with us today.
Thank you very much, Jenny. Thank you for that invitation.
That was really very insightful, including, of course, in the current situation healthcare workers are dealing with in Uganda. I hope that helped all of you in getting an idea of the discussions that we'll be having in a short while. So now we're going to be breaking into 3 groups. So we have 3 rooms or 3 workshops. One of the workshops will focus on the power of data. Sorry, let me just check that. Okay, so the power of data to improve and optimize the work of healthcare workers. And that workshop will be led by Jason Shalaby, Director of Global Health Policy at the Novartis Foundation. Another workshop will be about training and empowering healthcare workers through health tech. And that discussion will be led by Amy Finnegan, Senior Data Scientist at IntraHealth International. And the other workshop is about integrating digital and data science skills in national health education. And that discussion will be co-led by Samir Pujari, the Vice Chair of the WHO ITU Multisectoral AI for Health Focus Group, and Dr. Caroline Mbindio, Chief Executive Officer at AMREF Health Innovations. So for all the participants, I just want to remind you that you'd be able to use your camera and audio to interact during the workshop. There's also a raise your hand function if you want to say something, if you want to ask a question or share some learnings from your end. I would like to also ask people to introduce themselves in the chat box, so everyone knows everyone. And you'll also be automatically sent to the different breakout groups. So all sessions will run for 40 minutes, and then we'll all be back here in the main room after that. And I hope that facilitators would be able to give us some takeaways from your workshops. So I hope you all have a fruitful discussion, and I will see you in 40 minutes. Hi, everyone. We're just waiting for everyone from the different workshops to be back in the main room. Okay. I hope everyone's back. Um, I was in Jason's discussion on data and AI and integrating that, and how that's helping healthcare workers and others. So it was an interesting discussion. But right now, I'd like to give it back to our discussion leads or facilitators from different workshops. I'd like to ask each one if they can, um, give us some takeaways from the discussions you've had. Maybe Jason, you can start.
Sure, thanks, Jenny. And yeah, let me know if I missed anything. You were in the conversation as well. But there are a couple of things that did strike me, and I think that as we were trying to tease out some examples, again of how data science or AI have been, used to improve health outcomes in different settings. And again, what we heard today was the example of how, for example, your smartphone ultrasound, solution is being basically used to detect pregnancy risks in very remote settings in places like Sierra Leone, or another AI solution that was being developed around kind of looking at the detection of trichiasis, so eye condition, and bring up the question around how can we make sure that we use offline AI solutions and some of the challenges around that. Also, as well, I think what was interesting from some of the examples here and questions that came up were, if you are introducing such solutions, what's the impact on the healthcare system, right? Obviously, healthcare workers will adopt it, and it can be beneficial to them to improve screenings. But what is the outcome then potentially in terms of increased referrals to the broader healthcare system, and how you have to think about the broader package and integration of these solutions. One thing as well, which came out, for example, in Brazil, is that whether you're using AI for improving the detection of COVID or TB through X-ray imaging and AI algorithms, or looking at, for example, how can you improve the use of data for cardiovascular risk assessments. There's still a reticence, there's still a foundational basis and mindset around how do you not only use data, but is that data of the right quality? Do they have the right capabilities to really leverage those insights? And I think that's, again, one component that we have to really think about, kind of building that groundwork for healthcare professionals to really make the best use of data science and analytics. I think as well, one thing that came up as well is around this educational component, which I'm sure was discussed in the other working group. But it's one thing to introduce the solution, but are you providing the whole package of education, not only to adopt the product or service that's being brought in, but then is there continuous mentoring solutions that can take place on a real-time basis? And that, I think, again, there's this one example that we had shared of Manatee, for example, we're connecting different clinical professionals around the world as a digital app that's being introduced, and that could be one way of looking to solve this problem. So I'm sure I've missed some of these elements, but thanks again to all the working group for a very interesting conversation.
Thank you so much, Jason. I think you've got everything in there, and thank you for being brief on that. Can I ask Amy Finnegan to also share some takeaways from your own group?
Yeah, thank you for inviting me to facilitate this panel. We were talking about empowering healthcare workers with AI and a little bit about how to not disempower healthcare workers with AI. I just want to say we had a really diverse blend of folks in the room representing Egypt, the Philippines, Senegal, India, and other countries. I heard some excitement about what AI can do and the ease of coming up with machine learning algorithms for engineers and data scientists, but also contrasting that with the implementation of these systems on the ground and in real life, and tensions between political reluctance to adopt AI algorithms and who's going to pay for this, how will it be financed, how will it be scalable. So we had some high level idealist, optimistic feelings, but we also brought it down to the practical level of how can we really get this done on the ground. We ended the discussion of how AI will likely still need a human interface, right? So we want to be able to empower healthcare workers and task shift some of the more repetitive, redundant tasks to AI, like viewing paperwork or entering data from logbooks into the HMIS system, sending reminders automatically, so that healthcare workers can spend more time on that care, compassion, and empathy that humans can provide, right? So to be really keeping that in mind, what tasks can we shift to AI that can then empower healthcare workers to deliver more of that care that they probably came into the profession to do in the first place? So we really ended on, how can we make sure patients are included in this? And that's one thing that we came to at the end of the discussion. So yeah, I thought it was really rich discussion and happy to have everyone involved. And I hope that I was able to characterize our discussion.
Thank you so much, Amy. That's really interesting. And also I like the fact that there was a lot of those practical considerations, about who's going to pay for this or how we're going to do this implementation. And of course, having the patients really part of the whole, discussion. That was really interesting and important. Next, I'd like to ask Samir. Perhaps you can start some of the takeaways from your own workshop.
Thank you, Jenny. And I've got Carolyn to cover up for me if I made a mistake here. So I'll start off by saying, and again, stealing Carolyn's quote, which I love, and I keep on going to this one. AI, we all have to endorse and understand, is the future of tomorrow. It's not a question now that we have to put in there. And so the question that we flag and discuss about in terms of how can AI be helpful for healthcare workers? I mean, how do we prepare them? So necessarily, how do we bring the future to us faster or sooner? That was the big discussion that came in. And I think it was a very important point that was flagged there. I think the points that were mentioned by Amy and Jason came into our discussion also in terms of we need to make sure that this is AI is an enabler for the health workers. It's not a burden as it's perceived right now. And I think that's an important factor. And to make that happen, there were some examples that Kevin put out on how taking it from a people-centered approach, but very simplistic tools to help and enable that simple services on the ground is critical. And the trainings need to address those factors. They need to address what simplicity enablers these are making. One of the examples was COVID. Instead of, someone mentioned in the group that health workers today consider themselves data collectors most of the times. What we want them is to be empowered to make sure that the data is being collected by AI, analyzed, and be telling the health workers, go and take action here. That's what your health expertise is needed. And that's where that enabling component needs to come in. The other very important point that came out was we have to start very early. If we are saying we'll start training the health workers when they get to the medical schools, that's too late already. I mean, they are already into a very specific stream. We need to start right from the base, from primary education levels, to ensure that AI is integrated. And that's why collaboration, and then go up to the tertiary. We can't stop the bridging gap, which needs to happen. I think that's a lot of that is happening at the government levels. WHO's academy is trying to fulfill that gap. The governments are doing it. But in the meantime, we will start that baseline implementation also. And for that, collaboration is key, and partnerships and with the policymakers is key right at the beginning. So I think that's where we came out with a concrete action saying that we all understand it's important. We need to start working at the base, and together we pledged ourselves that we will do something or the other to move forward with that. But let me ask Carolyn to please come in and pitch in our discussions that we'll forward.
Yeah, thanks, Samira. I would say that, like the other groups, we agree that we need to build the rails on which this train will run. So looking at the questions around infrastructure, internet connectivity, digital literacy, access to power, and making that available so that we can then start speaking about AI. The other thing that we spoke about is how do we ensure that we are not widening the access gap when we introduce such sophisticated technologies when we're talking about medical education. And then I think third, but also really important, is needing to have a partnership between the patients, the communities, the rural communities who would be using this service, and the clinician, so that we can have higher levels of trust. We heard in the talk in the beginning, this question of, are machines going to take over the world? Do people really trust technologies when technologies are making decisions and not people? So really ensuring that that partnership is well thought about as we think of moving into AI. So that was the feedback from our group.
Thank you, Kevin. Thanks, Jenny. Back to you.
Mm-hmm.
Thank you so much, Samir, and thank you so much, Caroline, for all of these really, really interesting discussions. Unfortunately, I wasn't able to listen to all, but there's a very practical. There are innovations that are really exciting that we'll be seeing in the next, hopefully in the next few months. From the discussions Jason has had in the workshop, and Amy, talk about some of the really practical questions out there. And then Samir and Caroline, it was interesting, about when Samir said how can we bring the future sooner? We can't just start when healthcare workers are already in medical school, already working out in the field. We need to start at the primary level. And that's really interesting because right now there's a lot of technology out there. And so, some of us think that the kids of today are really more perhaps tech savvy than most of us. But that's a really interesting point. And also making sure that using all of this as enablers and not a burden to healthcare workers. I think that's really, really important. And also what Caroline has mentioned about digital literacy and making sure that we're not widening gaps. There's so many gaps in the healthcare system. There's so many gaps I'm sure we've all seen the gaps with vaccines, with COVID vaccines, but making sure that we're not widening any gaps out there, but actually being more inclusive. Those are really, really interesting points. And I've also learned so much. I hope all of our participants learned so much as well. Thank you so much, everyone, for joining, sharing your work, sharing your expertise. And just to say that if you're interested, I hope that, of course, this opens up further discussions. I hope some partnerships happen from this event. And if you're interested to, read more about technology and healthcare workers, we have an ongoing series at Devex, Building Back Better series. We have a website specifically focused on that. And of course, we have our dedicated global health newsletter that comes out every Thursday. It's called Devex Checkup, and I hope that you all could check and sign up to that, where we cover some of these things as well. So again, thank you so much, everyone, and I hope you all have a good day.